Hi, my name is Stefan Raphael. I'm a student at Tampa Medical College, and this video is a video about medication administration. In this video, I'm going to demonstrate how to properly give medication to a patient. But before we even get to that part, we have to review some safety tips. As you know, there's many steps before you give medication. Um, One of the things we're going to review is the right for medication administration. There are basically 5 basic rights for medication administration. The first right, you have to have the right patient to give the medication, the right medication before you administer it. That means to make sure that the medication is not expired, it's the medication that's been prescribed to administer to the patient. The right dose and the right route. So we're gonna look at the doctor's order for the medication to make sure that whatever the doctor's order, that's where we're gonna administer. And the right time of the medication, because each medication has a specific time to be administered. So first thing first, before we even get to the patient, first thing we're gonna do, we're gonna go ahead and check the doctor's order and the MAR to make sure that we get the right medication. Most hospitals use electronic MARs, so we're gonna pretend that this is my hospital thing. We're gonna look at the medication. First, we get lisinopril for the patient. Then we get a transdermal path, and we got the patient insulin. So once we verify on the MAR that we have the medication that is prescribed, we're gonna go ahead and go to the patient's room and do the safety check to make sure that we have the right patient. So now that I finish making sure that now that I finished checking the medication order and the MAR, I'm gonna go ahead and go to the patient room or go to my patient to administer the medication. After I've administered the medication, I will have to go and re-evaluate to make sure that the medication that I have gave was effective. One of the things that before we administer medication, if the medication is tied to vitals, let's say you're giving a blood pressure medication, we're gonna pretend that we did the blood pressure already, and then the blood pressure is good to give. So, which is not within the limit to administer the medication, especially with the lisinopril. That means the blood pressure is not too low. If it was low, we would hold the medication. And we did the ACU check to make sure that the insulin that we're gonna give is not gonna affect the patient adversely. So now I'm gonna pause the video, so we're gonna go ahead and introduce ourselves to the patient. Hello, how you doing?
Hi, good. And you?
Alright, my name is Dr. Raphael. I'm here to administer your medication that the doctor has ordered. Before we start, can you go ahead and verify your name and your date of birth for me, please?
Nadine Whitecart, 11/29/1987.
Alright, Miss Whitecart, I see everything is good. Let me go ahead and check your bracelet. Yep, that is the right patient. So, Miss Whitecard, you have your 3 medication today. We got your lisinopril that the doctors have ordered for you, and we have your patch and your insulin. Okay?
Okay.
So first, let me go ahead and give you the lisinopril. Before we even administer, for oral medication, we make sure that the patient is able to swallow. Since the patient is able to swallow and don't have no problem swallowing the medication, so I'm gonna go ahead and verify the medication one more time, and go ahead and verify the medication in the MAR. So yes, yes, and verify that's the right patient, that's the right medication, the right dosage, and the right route to give the medication. So once we make sure that we have the right patient for the medication, the right dose, the right route, and the right time, Then we're gonna go ahead and assess the medication, and if it's possible, we use that time to do some patient education. All right, Miss Roycott, this is your lisinopril.
And what is this medication good for again?
This medication is the medication that your doctor ordered to help you lower your blood pressure. That's lisinopril 10 milligram that you take twice a day, and this is the one in the morning.
Okay, thank you.
All right. So once you administer the medication, you go ahead and document that you administer the medication. Next, we got the patch. This is gonna be transdermal. We're gonna go ahead and verify the medication once again. All right, Ms. Wycott, this is your transdermal, the nicotine patch. It's what the doctor ordered. It's gonna help you for cessation of smoking, to help you stop smoking. Okay.
Okay, thank
All right,
you.
we're gonna. Last time we had it on the left arm, so we're gonna go ahead and put it in the right arm. So we're gonna make sure that the patient don't have no scar in the arm, and since the patient don't have no scar and no hair, and we're gonna go ahead and apply it right there. Thank you. So
Thank
one
you.
that is done. And the last medication we have for you today, you document that you document the side, left, right arm, and the back of the arm. You do that. So earlier we do your IQ check, and your IQ check, according to your IQ check, it's time to get your insulin shot. So I'm gonna go ahead and administer your insulin shot. Your insulin shot is sub-Q. This is a sub-Q route. That's where we're gonna administer. I look at the MAR. The MAR said to give 2 units of regular. So it's time to give the patient his medication. So this is gonna be your sub-Q insulin.
Okay.
We're gonna administer on the left arm. Okay. So it's sub-Q. It's gonna be subdermal. So it's gonna be in this arm and the fatty part of your arm. So you go ahead and pretend to pull out the medication, and while we're doing all that, we make sure that before I enter the room, I had wash hand and put on glove and everything. So you can turn on this way.
Okay.
So this is gonna be in the back of your arm, clean the side. And sub-Q medication is at a 45-degree angle. So in the fatty part of the arm, you're gonna go ahead and whoop. All right.
Thank you.
All right. Now, since we administer the medication, we make sure that everything is okay. We ask the patient, does the patient have any question or any question for me?
No, I'm good. I don't have any questions today.
Alright, so what we're gonna do, we're gonna document that we give the medication, the site that we give the medication, and also the time that we give the medication. Now, we're gonna pretend that 15 to 30 minutes had passed. We're gonna come back to the patient to make sure that the medication that we have give was effective, or there was no adverse reaction, just to make sure that everything went well with the medication administration. All right, ma'am, it's been about 15 to 30 minutes. Is everything okay? How are you feeling?
Feeling okay.
All right, so since you're feeling okay, no adverse reaction, no pain, no itchiness in the side of the patch or anything like that?
No, nothing.
All right, so we can determine that there was no adverse reaction to the medication that we just allowed. All right, ma'am, thank you for your cooperation. If you have any question, you can always talk to the doctor. Okay? So that concludes medication administration for the 3 rounds: oral, subdermal, and insulin sub-Q. All right.